Welcome. This is Josh Welch. Yes, we've heard a lot about coronavirus. Yes, I'm really going to talk about it too. Hopefully in ways familiar and in ways new. Most of what I share will be based on numbers. Some will be my opinion. I think it will be easy to tell the difference. My agenda, I'll talk about a coronavirus decision. Why am I doing this? Look at the data for the US and Oregon, and I'll put the pieces together to get to the overview. About a month or so ago, leaders across the planet had a choice. Shut down and find a solution, or say, sorry, a lot of people are going to die. Virtually every country made the same choice. Leaders are too busy on solutions to tell the story, so I thought I would. Why am I doing this? I'm a data analyst by trade. So back in late March, on the 26th, we were all talking about, let's reopen the country by Easter. So I said to myself, how about predicting the number of cases of coronavirus in Oregon that we'll expect to see on Easter and the number of deaths? Time has gone by, and as I compare my prediction to actual, I overestimated slightly on the number of cases, though it's a hard thing to say, but I guess the number of deaths pretty accurately. As with many stories, it has another start too, as the story starts coming out. This is how this government engaged us with this chart. The idea was to delay the initial peak and spread it out and reduce it so we kept within hospital capacity and we'd be able to deal with this better as a country. We did this quite successfully, as it has turned out. And when we were way back at the beginning of how this would all happen, it was easy to overlook what the situation would look like over here on the right when we got back to zero. We'll get back to zero when everyone that's had the virus has had the vaccination or has had a lot of luck. In the meantime, as time has gone by and we have spread out the number of cases, we now have a lot of data to look at. I see no reason in reinventing the wheel. Let's go look at the Johns Hopkins data and see what they have seen. Here is a chart. Each line is a different country. Italy, with so many cases and so much in the news, is highlighted. On the bottom is the number of days, and of course on the y-axis is the number of cases. Within the blur, it's a little hard to see the US, so let's highlight our country and see how we compare. Now you can see the US, also in blue like Italy was, also tracking Italy very closely, which is just a couple weeks ahead of us. I think this will continue, as we have a lot of coronavirus cases here as well. How is Oregon doing in comparison to the rest of the states? Let's scroll down and take a look at Oregon. This is a similar chart. Each line is now a state. Oregon here is at the bottom. We're actually tied for Nebraska for the state with the least number of coronavirus cases by population. It's a great thing. Kudos to everybody within government at all levels and in our healthcare system. Thank you. Let's go back to the PowerPoint at this point. In the US, I see a lot of chefs in the kitchen. the White House, the CDC, FEMA, the 50 state governments. I think American exceptionalism starts with leadership and teamwork. Let's pull the pieces together a little bit as we get towards the overview. On this chart, you have months over the next 12 to 15 months of time. On the y-axis on the left, we have number of people in Oregon. On the y-axis on the right, we have it expressed as a percentage. Since charts stories start in the lower left, let's look at the lower left and see information we're very familiar with. Our first case, everything closed down, situation on Easter weekend. As we slide across the chart into the center, November we'll have the presidential election. Sometime in about a year we'll have the vaccination. And then the vaccination will be made and you'll get a shot in your arm sometime after that. We're going to be talking about coronavirus for a while. Let's add a bit more information to this. Specifically, the table here of data. It's well acknowledged that there are many more cases of coronavirus than we've actually had test results for. Let's assume the number of these real number of cases is 5 times more than people who have been diagnosed so far. That would put Italy at just a little over 1% of its population, the US at just under 1%, and New York in particular at just about 5% of their population. New York tested positive times 5 is plotted here in the brown circles. And then US unemployment, which has been going up sharply, is around 11% now. In comparison, Angela Merkel, Chancellor of Germany, mentioned in early March that she expects 50 to 75% of Germans will get the virus. So how do we put this information together some more? Well, let's merge the initial chart with the information I just shared. We get something about like this. For a timeline, the gold initial coronavirus peak we never saw because we went into shutdown when we stayed home. In comparison, right now we're here in the blue part of the histogram with the New York tested positive, just a peaking, maybe a little bit after peaking, according to Governor Cuomo, and then hopefully the number of cases will subside. With some form of social distance continue along with mass testing until we get our vaccination shot in about a year, the government is trying to keep coronavirus cases well below 1%, in fact, a fraction of 1%. What they do not want to have happen is another peak of virus cases. This is a very delicate balancing line as we go across time to where the vaccination is provided, or we become very lucky at some point with information we do not yet know. I wish the governments and healthcare great luck in making this all happen. The future is determined by current and future events, if I may get philosophical for just a little bit. Life's milestones. We all have a number of them that we go through with the people immediately around us. I think we're going to have a year to remember doing this all together. To understand a problem, one needs to know the components to address it. This problem has a large number of components. Layoffs and business collapse, lack of insurance for a large number of people suddenly unemployed. Supply lines are getting disrupted. We'll hear a lot more about this. And People are getting sick. And there's a lot of people, and we all have different goals. I think it's a good time to step back and remind that with change comes opportunity. American exceptionalism. There's many ways this can come about. Perhaps a few would be to have the government mail everybody 30 masks a month. How about everyone who has been laid off or will be laid off auto-enroll in Medicare for a year? Intense contact tracing is being discussed by all the governors. I think we'll see more about serious quarantines as well. I think we'll also start to hear about personal and business bankruptcies. And of course, PPE will be a big topic. Changing slightly in another direction, how about every personality on TV wears a mask to model what we need to be doing? This will take a lot of work. How about every American maintain contact with 5 friends and 5 acquaintances, like neighbors and coworkers, to help us all get through this? Thank you. As I conclude my presentation, I'll show the agenda to show how we got back to it. Thank you for your time.